Welcome to the Wavy Digital Desk. We're here this afternoon to talk about Lung Cancer Awareness Month. There's been new screening guidelines that have been dropped recently, so we're going to get into those. We're going to talk about risk factors, what you need to know, and more. This is with Riverside Health System, and Dr. Enilari is going to be with us today talking about what you need to know. So I'm going to bring her on now. Dr. Enilari, thank you so much for joining us today. I know that this is, one of the deadliest cancers that we have is in the United States at least, and it also is very, common in both men and women. So thank you so much.
Of course, thank you for having me.
Absolutely. I mean, to start, I think, the newest headline, if you will, is the screening guideline update. So this could, as much as 5 million more Americans a year, sort of be recommended for screening. I mean, is that a huge difference really in protocol or what's been happening in the last, 10 years or so?
Sure, thank you. It's a huge difference because right now, currently, we're screening patients that between ages 50 and 80 years that are currently smoking or that have quit smoking within the past 15 years. With the new guideline, the 15-year restriction has been removed. So as long as you've smoked at least a pack a day of cigarettes for about 20 years or have an average of a 20-pack year history, and you're age 50 to 80 years, you can continue getting screened for lung cancer regardless of when you quit smoking. So that's a whole population right now that we're currently not screening that would now be eligible.
And I think for some people that maybe aren't familiar with the lung cancer screening at all, I think people talk a lot about breast cancer screening. They talk a lot about, screening for different types of skin cancer, but lung cancer screening is something I don't feel has been that common, at least in sort of what we've heard. Is that something that you hear that people are surprised that lung cancer screening is so available?
Yes, patients are surprised to find out that they can be screened. Some of them are not aware that this screening modality exists until they come to see me, the pulmonologist. But it is widely available. Any primary care provider can actually place the order for the low dose CT.
And, for people to get to that point where they're reaching out to you about lung cancer, is that a point where, symptoms are really widespread at that point, potentially even, dangerous or later stage cancers?
So it depends. I am seeing different types of patients in my practice. So some patients are coming in with early stage lung cancer and have no symptoms. The symptoms vary across the board. So some patients can have lung cancer and are completely asymptomatic. Some are coming in with symptoms similar to with cough, shortness of breath, chest pain, malaise, weight loss. By the time patients have these type of symptoms, for the most part, they are at an advanced stage.
And when they come in with symptoms, are those symptoms sometimes where to you it can look like a lot of different diseases or things, and then you sort of have to do future testing to sort of figure out what it is?
It is. There, not all the symptoms are specific to lung cancer. For example, weight loss or fatigue or night sweats, or they're not specific to lung cancer. So you have to do several tests to identify what is causing it and narrow down to lung cancer being the etiology.
Absolutely. So, in terms of screening, that's the preventative side. So, before people have symptoms, hopefully, and before they end up coming to you for pain, weakness, tiredness, as you said, I guess I'm curious, 20 pack sort of rule. And I saw the breakdown that it said either 20 packs per day for 10 years, or sorry, am I saying, or 2 packs per day for 10 years,
Mhm.
or 1 pack a day for 20 years.
Yes.
I think for some people that will seem A, like a lot, and then B, they might think, okay, well, can I just reduce my risk by just maybe smoking 1 cigarette a day or whatnot? But does it work like that on a scale that if you're smoking less, you're drastically reducing your risk, or is it really no smoking at all?
It's an all or none. Smoking, even one cigarette here and there, increases your risk for lung cancer. Even though the requirement for the low-dose CT requires you to have a 20-pack year history, meaning on average, like you mentioned, a pack a day of cigarettes for 20 years, it does not mean that when you have less than that, your risk of lung cancer is less. Your risk still persists as long as you're smoking. So cutting down, while it's good, we recommend you cut down if that's the closest thing you can do. It still increases your risk for lung cancer.
And in terms of, decreasing risk, is smoking the only way to decrease your risk? Is it also inhaling secondhand smoke that is a problem? I mean, what are some of those things?
Sure. So smoking by far and wide is the number one risk factor for developing lung cancer. So you smoking yourself and deciding to discontinue tobacco use is the primary way you can prevent lung cancer. Having said that, secondhand smoke is another reason you can develop lung cancer. So not exposing yourself to people that are smoking around you is a way to prevent it. There are other risk factors. Not all of them are modifiable. Some can be modifiable. For example, exposure to biomass fuels can be modifiable. Exposure to asbestos or radon, if you can limit those exposures, you can prevent lung cancer. But there are some risk factors that are not modifiable.
And are those risk factors that are not, are those usually genetic, or are those usually, a predispositions? What are some of the ones that cannot be modified?
So some of them are genetic. There's some types of lung cancers that are genetic. Also, patients that have underlying interstitial lung diseases um, have a higher risk of developing lung cancer. Some patients have had cancer in the past, and as a result, have had radiation to their chest wall and are now at an increased risk for lung cancer. Again, so those things have happened. They can't necessarily change them, so they're not modifiable. But the ones that are modifiable are the ones that we really talk about all the time, particularly tobacco smoking. So stopping that will definitely reduce your risk for developing lung cancer.
And then in terms of treatments for lung cancer, I mean, what are you seeing? Is that something where they come in and then you recommend, whether that's meeting with an oncologist and then even surgical oncologist, or what are some of the sorts of things that you all are doing?
So the treatment for lung cancer really depends on the stage. And that's why we again have on the importance of low dose CT, because if we're able to identify cancer at an early stage through the low dose CT at a stage 1 or 2, those patients can be cured. And curative meaning they would be free from cancer. So those patients, if they're a candidate, would actually undergo surgery or stereotactic radiation. For patients who have advanced cancer that is not that are not amenable to that is not amenable to surgery, then they would undergo chemotherapy or immunotherapy, and in some cases, radiation therapy.
And I know that can run, the whole scale, as you said. When you actually are getting people in the office that are developing symptoms, is that MRI testing, blood work that sort of lets you know what the best method might be for them?
We look at several things. So the first thing will be to diagnose the cancer itself. And then when we're doing the diagnosis, we're able to identify sometimes the lymph nodes during our procedure, whether those have been affected. We also do something called a PET scan, which is a type of CT scan where we give the patients radioactive sugar and then we scan their bodies. And that tells us if there's evidence of spread outside of the chest. We also do MRIs of the brain, depending on the type of cancer, to see if there's spread to the brain. If there is no spread anywhere else, based on the PET scan and the MRI, if there is no spread in the lymph node, and again, depending on the type of cancer that it is, that patient could be potentially curable.
And then, in terms of just keeping yourself healthy, we've talked about cigarettes and smoking, and you mentioned tobacco products. I think one of the things, especially in a younger demographic, that people think about are those vapes, those electric pens, things like that. And they have a certain flavor or they have a certain taste or appeal to them. And so I don't know if people understand the risks or really what the long term effects are. But are you seeing just effects in general, whether that's, cancer developing or other lung problems developing because of those types of devices?
Yes, that's a very interesting question because a lot of people want to go to vaping and think it's a safer modality. The issue is that there are so many vaping products out there. They're not regulated. There are all sorts of toxic materials in them. And while we may not have all the information right now to know whether or not there's a direct impact implication to cancer, we do know that patients that are vaping have come in with lung diseases and active inflammation. Some of them have an inflammatory response that can be very severe. So, while it seems like it's a less risky modality, it's not without risks. It does have its own problems, but we don't recommend it.
And then, you hear on the news, and I think people might think it's a scare tactic, but really that I think cotton candy lung is some of the terminology that's been used, but just because we don't know, as you said, what chemicals are in it. So your body can have this interesting reaction.
Absolutely.
And then in terms of, just in general, and you also see just regular patients, correct, for pulmonology and different lung areas.
Yes.
What do you recommend to them just to keep their lungs healthy, to keep them as healthy as possible, to sort of reduce risk if you're able to some of these diseases?
The main thing I tell my patients all the time is quit smoking. If you're smoking, we don't end the encounter without talking about it. That's the number one thing you can do to prevent dying young. That's is to quit smoking and to reduce your risk for cancer. In terms of general overall health, I tell my patients to exercise. Exercise benefits every single organ, and it does benefit the lung. So if you exercise and quit smoking are the two main things we talk about all the time.
And for that, for lungs, I mean, is that, getting your heart rate up, getting all of that air in your lungs, really doing some of that cardio as well?
It's any type of exercise. Any type of aerobic exercise is beneficial for any part of the body, including the lungs. So anything you can get, walking, biking, swimming, anything is beneficial.
And then, in terms of your area and your expertise, are patients coming in too to see you, just wondering about, the season we're in and just the relevance, for things like flu, pneumonia, things that can impact you right now, to maybe watch out for. I know not just during Lung Cancer Awareness Month, but just thinking of that lung health in general right now.
Yes, they are coming in. People are concerned about the flu, concerned about RSV and COVID, and we strongly recommend getting the flu shots and washing their hands. And when patients are sick, I recommend that they stay away from other people or wear a mask if they have to go out in public.
And then in general, during this month, I think it's great to have awareness month as long as it takes sort of the awareness all year long. But is there anything that you really want to make sure people know during this month in particular about lung cancer or about some of the new, I don't know if it's innovations or technologies that exist, or is it about the screening guidelines, but just, giving you the floor, just what's important to focus on this month?
What is important to focus on is knowing your risks. If you're smoking or have smoked and you have at least a 20 pack year history, you're eligible for low dose CT to identify lung cancer when it's at an early stage. As long as you're age 50 to 80, most insurance companies cover it. Just talk to your primary care doctor or any provider, and they will order this screening modality. That's the main takeaway. We should be screening patients for lung cancer because by the time they come in with symptoms related to lung cancer, most likely they're at an advanced stage.
And if you have any questions about your risks, are you or other pulmonologists, is that the best person to see to sort of discuss, what might be best for you given your history, given your age?
Absolutely. Any pulmonologist is trained in lung cancer and lung cancer screening. So talking to us or even your primary care doctors is the way to go.
Well, Dr. Enilari, I don't know if there's anything else, whether in your scope and in your field for lung cancer or just in general that you want to speak to. But in terms of the tips you gave and sort of discussing what your risk factors are and really getting to know your body, I think that's extremely helpful and relevant, for viewers here.
Absolutely. Yeah.
Well, thank you so much for joining us today. And I guess the best place for people to go, I'm going to post on wavy.com, just show the link back to Riverside where you are, as well as, different information about those screening guideline changes. But as you pointed out, this should not be looked at as one cigarette, then we'll be fine. We talked about that sliding scale. So thank you for those tips and thank you for your time today.
Absolutely. Thank you.